So the drug for my injection is Lantus, otherwise known as insulin glargine. So I'll start my medication administration by looking at the MAR here. So I can see that under the scheduled medications for Lantus, I have, it's double verified with a transcriber and a nurse signature. So because I have those two signatures, I don't need to compare it with the MD order sheet. And I also have no doubts about the accuracy of the transcription. So I can go right to taking my stock supply of the Lantus. And comparing what's on the label here to the MAR, just to make sure I've taken the right bottle. So I have, as part of my first check, I have the right medication, Lantus insulin, right dose, 10 units. I have a 10 milliliter vial here with 100 units per milliliter concentration. I have the right route, subcutaneous, for subcutaneous injections only. The right time and frequency, every AM at 0800 hours. The time is now 7:50. So we are within that time frame where we can start preparing and administering the medication. As well, on our diabetic flow sheet, we have an AccuCheck done at 7:40 with a 10.8 blood glucose reading. So as well, that is within the safe time window, and that is a glucose reading that's high enough that we can give the insulin. So also on the insulin, we just want to make sure it's not past the expiration date, which it isn't. And this is an unopened bottle. If it was opened, you want to make sure it's not going 28 days past when it was opened, which it's not. But just look out for that. So our patient has no known drug allergies or no known allergies, so nothing conflicts with this bottle. If it was their first time getting it, obviously just be aware of hypersensitivity. So I'll put that to the side, perform hand hygiene, just tell you about calculations of the drug or for how much we need to draw it for the dose. So we're using a Vantage Point insulin syringe. So the insulin syringe is specifically made for insulin, and it's actually measured in units. So we're going to draw back to the 10. So because you don't need milliliters, if you did want to know the milliliters, I said that really weird, the milliliters, you would put the dose the doctor ordered, so that 10 over the that concentration there, so 100 times the 1 milliliter stock. So you get 0.1 milliliters you're drawing up. But again, you're just looking at the units. So a little bit about the drug is that Lantus is an anti-diabetic and a long-acting insulin. It works to decrease blood sugar by transporting glucose into cells as well as converting glucose to glycogen. It is used in the treatment for insulin requiring diabetics, so type 1 and type 2, such as the type 2 diabetic in this scenario. Common side effects include hypoglycemia, dry mouth, blurred vision, redness, and itchiness at the injection sites, lipohypertrophy, so that's why we're rotating sites and then rotating within the sites. And although the risk for hypoglycemia is low for Lantus, because it doesn't have a peak, it's still important to monitor the signs of hypoglycemia as well as educate the patient what they may experience if they are going to a hypoglycemic state, such as chills, anxiety, hunger, confusion, appearance of pallor, dizziness, and sweating. So monitoring blood sugar after insulin injections is highly individualized or unique to each patient. So in the sense of how often you check your blood sugar. So some maybe check more frequently, less frequently. So that's just something to consider with your patient. As well, other facts about insulin is that the onset is 1 to 3 hours. It should never be mixed with other insulins. The safe dose is, again, highly individualized, so it varies between patients. It is taken only once a day because it's 24-hour duration. You want to also take it at the same time every day, like not flip-flopping between night and day and all that. So prior to administering this insulin, we would check their blood sugar with the AccuCheck. So that was done at 7:40. So in the parenteral drug monograph that we'll look at, it says insulin is a high alert medication. So again, that's part of that is we need to double check with it. So we're getting a tuner's check just to make sure that our process was right and that we've drawn up the correct amount. It says here it can be given subcutaneously, and it can be administered by a student nurse. So that works well because I am that. Potential hazards are hypoglycemia, like I mentioned before, and again it says do not mix. Okay, so now that we've done that, we can begin preparing the medication. Just perform a hand hygiene there. So we'll start with selecting the correct syringe. So we're using a Vantage Point insulin syringe. It's a 1 milliliter U100. It's specifically made for insulin. It can be given subcutaneously, and even the sizes here is 29 gauge with a 1/2 inch needle there. So those fit in the parameters of what can be given subcutaneously. So we're preparing the vial here. We will take a alcohol swab, an unopened one, or so before that we would have cracked off the top there, and then the imaginary top. We'll clean that for 30 seconds, just in the interest of saving time for the video. Pretend it's 30 seconds and zoom forward. So after we've done that for 30 seconds, we'll let that dry. And I'll just get the needle ready, or the syringe ready, sorry. So we'll wing that back, pull out, holding out there. So we'll be drawing back to that 10 units. Insulin, you want to be really precise, so just take your time with it. So that's at the 10. We've drawn back the air for that will inject into the top. So now that this is dry, we want to make sure it's dry so no alcohol is being inserted. We'll take off the cap for that. And inject that into the top there. Injecting the air. And then pulling back. We're going to draw back for our 10. And again, with insulin, you don't want there to be any bubbles. So now that all my bubbles are gone, there can be a bubble at the top. You just want to make sure that it's not going below that first line and that it's not more than half. So, okay, so yeah, that's good. So I'll take that away. I'll use the swoop method to put that on. We're going to immediately prepare a label. So we have Jake Nursing. Drug name is Atlantis. Insulin Glargine. The dose is 10 units. The volume was at 0.1 ml, even though you didn't really draw up mLs. Concentration is 100 units per ml. And the time is now 0755, just because we took that time to talk. It sucked up about 5 minutes. And then at February 7th is the date, 2021, and my signature. And this is what we'd immediately tape to the syringe here. I don't have tape in my household right now, so let's just pretend I'm imaginarily taping. Imaginarily is not a word. Putting tape on there. And then I'll just bring the camera over so that you can see my label with my what I've drawn up there. So that's what I have reading on my label, and then just the lack of bubbles. There is a bubble at the top, but it doesn't dip below that line. Okay. And again, we're never leaving our medication unattended. And we're going to get a second nurse just to verify that we've selected the right insulin and we've drawn up the correct amount. That's because you want to be really precise with this drug. So now we can do our second check, and we can compare the MAR with the label, with the syringe, with the bottle there. So we have our right patient, we have Jake Nursing. We have our right medication. So we have Atlantis insulin. We've drawn up Atlantis insulin. Right dose, 10 units. This was able to make 10 units. We have 10 units written. We've drawn up 10 units. We have the right route, subcutaneous, can only be given subcutaneously. We have an insulin syringe that can be given subcutaneously. Right time and frequency is every AM at 0800 hours. It's now 7:55, so we can, that fits within our time parameters. I'll put that down, I don't know why I was holding that. So yeah, that's our second check, and so we can put that away, and also never leave our meds unattended. And again, just making sure we also have that label of when we opened it for that 28 days. So that's gone. Okay, so second check is done. Never leave meds unattended. I'm just going to take my meds on my I don't have a tray, but I'm going to pretend to be entering the patient's room. So when entering the patient's room, I'm going to do a quick general survey and safety check, just making sure there's no hazards on the ground for them. The patient doesn't look like they're in any distress. As well as patients not in any distress, the equipment around them is functioning properly. And just for the sake of this video, just for the sake of the video, I'm going to sit here just so you can see my head. So you'll start by introducing yourself. My credentials. So hi, my name is Sarah Kennedy. I'm a second-year student nurse from the University of Manitoba. I'm just here to do your medication administration today. Is that okay? Good. Are you able to tell me your name? So you want them to verbally tell their name, first and last name. And can you tell me your birthday? Good. And those, you want to make sure those match your MAR. And then I just want to check your armband here if that's okay. So so on the armband here we have Jake Nursing, and we want to make sure the FIN number and the date of birth also match up, so that those unique identifiers are matching up. And can you tell me if you have any allergies? No? Good. That's what I have on my records too. So if you just give me a moment, I'm just gonna take a look over your medications again. So that's where you're comparing your MAR with your label with your syringe here. So again, we have our this is your third check there. So we had our first check at the beginning, and then we had the second check that we were comparing the MAR with the label with the bottle with the syringe, but this one is similar to the second check, just without that bottle there, or the vial there. So yeah, we'll be doing it right patient, Jake Nursing. He said he was Jake Nursing, and we saw it. So right medication, Lantus insulin. We've drawn up Lantus insulin, 10 units is the right dose, 10 units. Right time and frequency is every AM at 0800 hours, and the time right now is 0800 hours. So that works as well. And then, so now that we've done our third check, we're going to tell the patient, provide a bit of patient education about the procedure. So today I'll be administering your injection of Lantus, otherwise known as the long-acting insulin glargine. The insulin is an anti-diabetic drug used for your type 2 diabetes, and it works to lower your blood sugar. Common side effects include dry mouth, blurred vision, redness, and itchiness at the injection site, and hypoglycemia. So that's where your blood sugar gets too low. So although Lantus has a low risk associated with hypoglycemia, it is important to be aware of the signs that you may be having a hypoglycemic reaction. This would include being aware of any chills, anxiety, hunger, confusion, dizziness, or sweating, and to let your healthcare professional know immediately so that we can work to get your blood sugar back up. In terms of assessment beforehand, at 7:40 a.m., we assess your blood sugar to be at a 10.8, which is a high enough value that we can give you the insulin injection. And today I'll be giving you your injection in the right lower quadrant of your abdomen. So in terms of selecting a site for subcutaneous, and especially for insulin, the best places are the backs of the arm, the abdomen, the buttocks, and the thighs. So I'm going to be choosing the right lower quadrant of the abdomen, so just right here. And you want to also document where you're giving it, just so you can know to rotate those sites and rotate within the site. So it's important that I said right and not just abdomen. So for my abdomen, I have a sock abdomen. So for this, pardon me, just before I prepare it, I'm just going to tell you about a little how I'm going to be bunching it. So for subcutaneous, if I was only able to bunch 1 inch, I'm going to be coming at the injection with a 45-degree angle. If I was able to take up 2 inches, 90-degree angle. This, I'm going to say I can only bunch up about 1 centimeter, so I'm going to be coming at that 45-degree angle there. So I'm going to put on gloves. I'm going to put on the gloves there. And take my, my alcohol swab here. So I'm going to be cleaning this for 30 seconds and just working in circular motions outwards. So in the interest of saving time, fast forward 30 seconds so I can discard those. And I'm going to be taking my syringe here. And we're waiting for that to dry. And now that, let's say it's dried, just one thing to point out. Just because it's an insulin syringe, there's a vanish point, which means when I inject all the way in, I'll inject to the point of clicking it in, which means the needle's retracted and all the insulin's within the tissue. I'm not going to be doing that. I'm just going to be verbally saying it. So normally when you retract it, the needle's retracted, you can let go of the bunch. So you don't want to let go of the bunch until that, but yeah. So I'm going to remove the cap there with my ring finger and thumb finger, bunch up that 1 inch of tissue, and then at a 45-degree angle, I'm going to insert, stabilize with my non-dominant hand, slowly inject, activate the vantage point so the needle's retracted, which means I can let go of my bunch there. And I'll take a cotton swab, put it there, hopefully it stays, and I'm not massaging the site, and just because I didn't retract it, I'm going to put it on that way, and I'm going to dispose of that in the sharps container, take off my gloves. So things you'd be monitoring for, first is the therapeutic effect of lowering the blood sugar, so decreased polyuria, decreased polyphagia, and the polydipsia, but also just monitoring that their blood sugar isn't getting too low, just making sure it's in a safe range and they're not going hypoglycemic. So again, in terms of monitoring, it's really individualized with the patient, like I mentioned before. And again, we educated them to let us know if they think they're getting hypoglycemic, but again, with Lantus, it's a pretty low risk for that. So I'm just going to put my right lower quadrant to the side. So writing on the MAR here, where's my MAR? Okay, there it is. So it was given at 0805, and then I'm going to put my initials, SK, UMSN2. Okay, and then we can write on the diabetic flow sheet as well. Just that 10 units glargine insulin was given subcutaneously with the time given 8:05, with my initials there and any the comments. So the site was the right lower quadrant. So it's important to put the site just so that they can rotate and such. Okay. So before leaving the room, I just want to make sure that the patient's doing a safety check, the patient's not in any distress, that their bed is lowered, their brakes are on, their railings are up, that the lower foot railing can be down, that they have their call bell within their reach and don't need anything else. So we can exit the room. In terms of writing down things that we assess for before giving the medication, that was kind of written in our diabetic flow sheet with that 10.8 blood glucose reading. So that was actually written before in the diabetic flow sheet. You can include it as an IPN note as well, but yeah, that was kind of the key assessment beforehand. And then just, yeah, making notes about after, like we did educate the patient, so that can be written about just so they know kind of what to expect or what to look out for. And yeah.